The following program contains mature subject matter. Viewer discretion is advised. Have you ever come across a disturbing photo that makes you stop in your tracks and wonder, what is this? What happened, and could it happen to me? Well, take a look at this image. What do you think this is? Take a guess?
A lot of people are saying cyst.
A lot of people think cyst.
Well,
Yeah.
cyst? Well, you're close. And
Splinter?
the history here is this progressed over several weeks. This mass enlarged, and it was found to move along with the heartbeat. So as a hand surgeon, you know what's going on there, right?
Oh, absolutely. We see this really often. This is a type of thrombosis in the hand, or specifically a type of aneurysm. And there are two types of aneurysm. There's a true aneurysm and a false aneurysm, depending on which layers of the blood vessel are actually outpoking, basically. So when we see something like that, we often think of three specific things. Number one, could this be a foreign body that's just enwrapped with fibrotic tissue? Could this be a cyst of some type, like a ganglion cyst, epidermal inclusion cyst? Could it be a lipoma, fatty deposit? Or could it be something tumorous or more cancerous in nature? Or could it be a thrombosis like this, like an aneurysm?
And how this developed, this was a strep throat process that turned into sepsis, which then turned into a bacterial endocarditis.
Right.
The patient went into sepsis, so this was seated in the hand, causing the formation of an aneurysm. Patient was treated with IV antibiotics, but ended up getting a valve replacement because of the bacterial endocarditis.
Yeah, so to be clear, the bacteria, the strep bacteria, actually lodged in the heart valve.
Absolutely.
Yes.
Got
And
into
then
the blood.
traveled
Yeah.
elsewhere through the blood to all
Absolutely.
these other places, causing this aneurysm.
Yes.
Patient had also lost 26 pounds,
Yeah.
so
That's
was pretty
tremendous.
sick.
So they knew that there was
This person
something
was
Yeah.
very, very sick.
Very sick.
Fortunately, the patient did well. All right, let's take a look at this next picture. Dr. Batra, you're the expert on this. What is this?
Well, so this was actually my patient, and this was his arm, and he came in to see me after a trip to the Dominican Republic. And this started as a kind of small reddish bump and gradually kept expanding to form this really firm, crusted ulcer. And it turns out this is something called Leishmaniasis. And it's actually a parasitic infection that's caused by the bite of a sandfly that then transfers that parasite into your skin.
Those are so small. Did he even notice the bite happen?
No, not at all. So these are much smaller. The sandflies are actually like the third of the size of a mosquito. But this is actually very, very common in tropical climates. So the tip off here was the travel, but this can actually occur in two forms. Fortunately, this was related to his skin. This was cutaneous leishmaniasis. But there is a much more dangerous form that's endemic worldwide. It's called visceral leishmaniasis. That can affect your internal organs. It can enlarge your spleen. That can make you feel really lousy with fevers and chills. Fortunately, this can be treated by antiparasitic meds, but actually occurs much more than we realize in our little bubble of the west side of Los Angeles. It's about, it's 1 million cases worldwide per year.
And as so often happens, the diagnosis came to you through the history, right?
Absolutely.
And for all of us, no matter what our specialty is,
History is
it's history, history, history.
Absolutely.
Right.
And you know, for you watching out there, you may not have gone to medical school, you're not a physician, but if something develops, think about where you've been, what you've touched, what's different in your life. You can be your own medical detective.
Absolutely.
To get a little bit of a pulse for what's going on. We have one more picture for you to ooh and ah over. Dr. Batra, we're going to defer to you again, because I think this is another patient of yours.
No, actually, this one was not, but this is something that actually Dr. G and I both see in our clinics. The
Luckily,
photo
it's not
is
usually this bad.
Yeah, the photo is much more pronounced than you might always see, but this one is just the feet. You see these blisters. This can also occur on the hands and in the mouth. This is hand, foot, and mouth disease, which we typically see in small children, but in this case was a 36-year-old gentleman, and this is caused by an enterovirus. So tip-offs are, in addition to the characteristic blisters on the palms and the soles and in the mouth, you might have a fever, you might feel a little bit lousy, and fortunately this is just a viral infection that's self-limited, just fluids, rest, but very contagious. So one thing to know is if your kid gets this, be very careful.
And actually, very much like the tonsillitis, one of the things that we have a problem with is that little kids, and usually this is under 5, because most people over 5 have had it and have some immunity, is they can't say, oh, I don't want that warm drink because it stings in the back of my mouth. So you'll notice that a kid is having less oral intake and seems uncomfortable and wants to eat or wants to drink and then stops right away, and that's a time to look, but even if you don't see anything, come in.
The other thing about this is because children often can't drink or eat because of the pustules in their mouths, they'll get very, very dehydrated.